Hey everybody, this is Valerie Van Boeven. I'm a registered nurse and the co-owner of LTC Expert Publications. And today we're going to talk about online marketing for hospice agencies in 2018, websites, visibility, authority, and leads. So on our agenda, the first thing we're going to talk about is websites, 2018 elements of a great lead generating website. Content, write it or buy it, but have it. Social media, all the accounts you don't need and the ones that make the most sense. Google and SEO for hospice agencies, e-newsletters, create it or buy it, but have it, and reputation, managing, controlling. It's possible and it's worth it. So our objectives for today, attendees will be able to write down 3 social media sites that are appropriate for hospice agencies. Attendees will be able to describe 2 advantages of monthly newsletters, and attendees will be able to describe 2 important aspects of managing online reputation, which are also called reviews. So websites, 2018 elements of a great lead generating website. I'm going to take you through some screenshots of some websites that we have created at LTC Expert Publications and some that we have not created. They are other websites, but all of them have some key elements about them that we really like. And those are the things I really want you to pay attention to. So no matter who does your website, there are some key elements that are really important. The first thing I want to tell you is that we build all of our websites on the WordPress platform. And we feel that in today's marketplace and with all the things that are, changing, WordPress gives our clients the best SEO options, and it gives us the best flexibility as far as content, moving things around, and making changes. So that's why we use it. The first website you see here, this is a screenshot of Provident Care. This is a home care agency. The things I want you to pay attention to are at the very top. So before you even scroll down the page, you can see their service area, their phone number, and lots of calls to action, which we'll talk about in a minute. This is another one. This is not a website that we created, but I really do like it. You can interchange this with hospice, so hospice patient guide or hospice family guide. Learn more about the types of hospice care or palliative care and support hospice can provide. I think this would be an excellent option for hospice providers to have this kind of guide right on the homepage of the website. I love this site. It's mobile responsive. You can see their phone number, top right-hand side, and it's very easy to navigate. Here is it's kind of a far away screenshot, but this is a website that we created. The boards at the bottom of the page, that is my slide. That is not what the website looks like. But this is the top part of that website. So they have some very colors that are very easy on the eyes, and they do a lot of explaining in the navigation. This isn't big giant navigation like we see in most of these, but it does have a lot of options to read and learn, which I think, as you all know, is very important in hospice and palliative care. People often have maybe the wrong idea about hospice, and the level of support is so tremendous that it's important they understand how much support they can receive. So there in the navigation you see why hospice, the serenity difference, when is hospice right, community services, and then of course for clinicians, get started in contact. But you can also see their phone number right at the top. Very easy and clean. There's nothing super fancy about this. And I think when someone's in a position where they're trying to decide what to do, and implementing hospice to a consumer often means, pretty quickly end of life, whether that's really true or not. They're in a, maybe a kind of a overwhelmed state, stressed out state, maybe a sad state. And it's important to get them the information they need and keep it easy on the eyes, easy on the brain. Another home care agency website. Any of the sites that you see here can also be used as hospice sites or hospice style websites. The wording needs to be changed. Maybe some of the pictures need to be changed to something more serene and inviting. Maybe not super happy, laughing people, but something easy. And certainly any of these can be used. But the common denominator is that the phone number is right there, top of the page, the service area is right there, and the calls to action are easy to see. Same with this one. You can see the phone numbers right up front. You can see their messaging easily. There's no doubt about how to reach these folks. Another one, very good for hospice. I love this model. I love the colors. It's very easy on the eyes, and it would be a great color scheme for hospice. And of course, the wording would have to be changed. This is a website that we did not create. Those others were ones we created. This one is for dementia specialists. These folks at Tender Rose Home Care, they only take dementia related, or people with dementia related diagnosis, or Alzheimer's disease. And so that's their specialty. They charge a premium for that, and they have a really nice, clean, easy website. So the important thing to know about these sites is people, when they come to the site, whether they were referred to you or they hit upon you just by chance because they're doing a search, the two things that are important the moment they hit your site are, can you solve my problem, and don't make me think. So solving my problem means I am in the middle of an elder care crisis or a health crisis with a loved one or myself, and I need solutions to these problems. I want to be pointed in the right direction quickly. So please solve my problem. So your website needs to first and foremost make sure that it states that, somehow or way that you can solve their problem. You're the specialist, you're the one, you're the folks, you're the team. And Don't Make Me Think is actually the title of a book that was written for web developers. And the premise of the book is that you need to consider your audience. Many of them are not web savvy. And in the home care industry, when we have clients come to us, or potential clients, whether it's hospice, home health care, or private duty home care, they are not home care hospice savvy, and they're probably much less hospice savvy than they are home health care savvy. So there's a lot of ways to get confused. It's easy for them to not know what to ask. So keeping it simple is so important, and they don't talk the talk. They don't talk the healthcare language the way we do. For those of us in the healthcare industry, they don't understand what an ADL is. So those are the kinds of things we want to think about when we're creating our website. Calls to action. A call to action means that when you're looking at the website, there are places on the website that tell you exactly what to do. Call now, fill out the form, get started. Those are the things that people need to see that makes it easier on their brain to make a decision to reach out to you. So if you're hiding the phone number down at the bottom of the page, or you're hiding it on the contact us page, or nobody knows how to fill out where the forms are on the site, or it's not apparent, then you need to rethink how your website is being developed and how it's the user friendliness of it. So you want to make sure your calls to action are front and center, and the only two things you want people to do from your website are, number one, make a phone call, or number two, fill out the form. Now, if they need education and they're going to read your other articles, that's fine. But at the end of the day, the bottom line for everybody is to get them to call or fill out a form. They need to make a connection with you in order for you to win their business. So this just goes back and points out all those calls to action and the information that we're giving the consumer to help them understand how to make or take the next step. So we're showing them our service area, our phone number. It says call today. We give them the option of getting started and find senior home care in your community, or find hospice care in your community. And these are easy things that they can click on or do, and it doesn't take them very long to figure that out. Your messages on your homepage of your website should be short, simple, and to the point. Long dissertations of why we got in this business, or long definitions don't belong on the homepage. If someone wants to read more about what hospice or palliative care is, they need to go to the pages that talk about that. Messages on the homepage should be short, simple, and to the point. So you can see that right here, where we have a lot of messages, but they're very segmented and they're very short. And the phone numbers stick out, and you can see them very easily. This is the bottom of that same website we just looked at. This is a screenshot of the other options they have on that page. So if they do scroll down, they're still going to see getting started, Alzheimer's and dementia care, caring for our caregivers, specialty services, testimonials, our caregivers. So they're going to see more options. But the important piece is that you get them the information they need at the top of the website before anything else happens. This is the bottom of that residential home health website, the one that offered the free brochure. I really like this website a lot. And it talks about home health care at a glance right here. This is the bottom of their website. So this could easily say hospice care at a glance. And they give 4 sort of balloons or paths. Your physician prescribes home care, nurses and therapists come to the home, custom care plan helps meet goals, and Medicare covers 100%. And then they have a little video that they had created that talks about home health care. This would be a great way to present hospice care for people who have never used or received it and know little about it. So is it all worth it? All of these things, making sure they all work together and that you have your calls to action. The only way you're going to know if your online marketing is really working for you is to track it. So in hospice and in home health care, we are all very good at tracking things like outcomes and diagnoses and hospital readmission rates and things like that. But for our marketing, we need to be better about tracking every form and every phone call that comes in and knowing how that person found us. Was it from our website? Was it from a radio ad? Was it from a TV ad? Was it from a referral source? Was it a neighbor? How did you find us? So we need to be asking that, and we need to be marking that down in our CRMs next to that potential client's name every single time. If we don't keep track of where our leads and our clients are coming from in reality, I mean, not just off the top of your head, well, I think most of our calls come from referrals. If you don't mark it down and know, you'll never know how well your online marketing is working for you. So you have to actually take the time to make sure everyone who answers the phone is educated about asking those questions and make sure that it's being recorded. Without that data, you will never know how much potential there is in getting more clients from the online marketing efforts. I will tell you that, for instance, my father is on hospice care, and my stepmother, who is his primary caregiver, she found their hospice company because she was doing a search for hospice, and she was online looking at different things, and she was looking at some senior living opportunities in Warrensburg, Missouri, which is all the way across the state of Missouri from where we currently live. And she actually came across the hospice company that now cares for my father because of the searches she was doing just in senior stuff in general. So their online marketing is what helped lead her to them and open the doors for them to get a new client and for my dad to get all the services that he's receiving. So online marketing is completely worth it. You need to up your game, and you need to do it well. All right. Content, write it or buy it, but have it. You got to have content. So what is great content? In 2016, 17, 18, 19, 20, and on and on and on, content will be king. You have to have unique content being added to your website every day. So on our blog or on your website, you should be able to add new blog posts or articles. And those articles don't have to be long. Some people will tell you, oh, they must be 1,100 words or more. That's a lot of article. And you have to remember that people have zero attention span, and they have zero desire to sit there and read some long dissertation on something they don't understand very well. So keeping the article short and to the point is very helpful. 400 to 500 words plus photos is good. It should be unique, not copied from others. It should be, of course, about articles that are about things in your niche. So if hospice and palliative care are what you do, you wouldn't want to be talking about maybe, something completely off the mark that wouldn't make sense for you. So keep them relevant. They need to be about your community and about your community involvement. So you're a local business, and you want to make sure that you're reaching out to your local community. And you want to involve yourself. So you have that direct referral marketing going on all the time. Talk about it, write it down, take a few pictures, and put it up as a blog post. Your community will appreciate that. And the content, again, has to be unique, not copied from the New York Times and not just a regurgitation of something on someone else's website. This is kind of what content looks like. Now, this is the home page of a website. This is the bottom of the home page of a website. And you can see on the right-hand side, senior care in Simsbury, Connecticut, dealing with COPD. Those are all articles that were posted to this website as blog posts. And you can see they also have some testimonials, and they have their location with the Google map. So they really do have a lot of stuff there, but their content is what we're going to look at. Oop, let's keep going. Okay, so this is what a blog post looks like. This is at least the top of it. And for this website, what you can see is that they do have the same calls to action on every page at the top. We call that the header. In the header, they have senior home care in Enfield, Connecticut. That could always say hospice care. You have the service area listed there, and you have a toll-free number. So that is always present on every page. That is the header of the website. On the right-hand side, anytime you see a blog post, you're going to see on this site and all the sites that we create a Contact Us form. We want to make sure that when someone is reading a blog post, say a new blog post went up today and it posted on Facebook too. So if they click on that Facebook post, they're going to be taken right back here to this website to read the whole thing. And that's great, but we want to make sure that person, it's the first time they visited the site maybe, they haven't been to the homepage yet. We want to make sure that they have every opportunity to contact us. So they have a form, they have a phone number, and they can see what our service area entails. So that is what content should look like. E-newsletter, create it or buy it, but you got to have it. And this is the truth. A monthly newsletter is so important for every business, but especially for hospice care, home health care. It helps avoid follow-up failure. So the most important thing to know about follow-up failure is that you are, if you're a marketer or an owner of an agency, you are in front of people every single day. And you're collecting business cards and you're collecting email addresses. And it's almost impossible for us to be organized enough to follow up appropriately with every single person we run across. It's really hard. But putting people on a monthly newsletter list is really an easy thing to do, easy thing to remember. And then if you automate that monthly newsletter, that takes the pain out of having to create one every month. So that's what we do for our clients. We set up an automated RSS feed newsletter so that the newsletter system looks at their website, takes all the blog posts from the last 30 days, puts them into a newsletter format, and sends that newsletter out. It does this on its own every month, and it goes out to everyone on their contact list. So what you need to do is collect as many email addresses as possible off of all those business cards that are sitting on your desk, all the business cards in your purse or in your pocket or your wallet. Put those people on your email list and make sure they are receiving your monthly newsletter. Your Google Analytics traffic will go way up. You'll see spikes in traffic every time your newsletter goes out. And the communication between you and people who didn't, they're not involved in your services yet, but they may need them someday. That communication goes way up. So if you've had a talk with someone and they maybe last month they called your office and they talked about their mother, but they didn't pull the trigger, they didn't put her on hospice yet. They start receiving your newsletter and maybe a couple of months goes by and they receive your newsletter and things are not going well and they're still trying to manage her at home, and finally they know that this is it. And so they've already established a relationship with you from that initial phone call they made. Now they're calling back and saying, you know what, we think it's really time. And they put that person on hospice or palliative care, and it's because you kept yourself, your business, top of mind with them. You sent them a couple of newsletters over the last couple of months. They didn't forget about you. They weren't referred to somebody else. They already had a relationship. So they called you back and said, you know what, we think we're ready. So anytime you can put someone on a monthly newsletter list and send that newsletter out without fail, that is a good thing for your bottom line. This is what our newsletters look like, and I will tell you that this is extremely simple on purpose. First of all, this is a very mobile, responsive newsletter. And this is our newsletter, so this is not exactly what our home care agency newsletters look like, but they're very similar. And if you want to subscribe to this one, you can go to homecaredaily.com and you can sign up for it so you can see it on your smartphone. But people who are reading your newsletters are not looking at them on a desktop. They are looking at them on a mobile device. Same rule of thumb for your websites. Your websites are being looked at on mobile devices, so it's more important than ever that all of these things are very mobile responsive, that they're easy to read on a mobile device. That means that you need to keep it simple. You see what we have here is a title of an article, maybe a little picture, a short paragraph, and a read more opportunity. So when they click on the title or the read more link, they will go right back to the Home Care Daily website or your website and read the whole article. So people can easily scroll through this newsletter, see what they want, see what interests them, click on something they want to read, and then move on. They're not going to read long dissertations. They're not going to read long paragraphs of text for every single article here. Most of the articles may not apply to them. Maybe only one does. So it's important that you keep it short, simple, mobile responsive, and easy on the eyes. And that is what a 2018 newsletter should do for you. And it also should be automated, and it shouldn't be something you have to think about. So keep that in mind when you're doing newsletters. Fancy is out and efficient is in. People are sitting on the potty, they are sitting in traffic, they are sitting at lunch, and they're waiting in a line, they are sitting in a doctor's office, and they are scrolling through their email. They see yours, they click on it. If it's not easy to manage and easy to read, they're moving on. All right, enough about newsletters. So social media, all the accounts that you don't need and the ones that make the most sense. LinkedIn, Facebook, Pinterest, Twitter, where are we going to go with all of these? Do we need them all for hospice care? And my answer to you would be yes, you should have them all, but there are only two that make the most sense here. You are never going to get a client from Pinterest or Twitter. You do not need to be a Twitter expert. We will talk about Pinterest. You do not need to be a Pinterest expert. Facebook and LinkedIn are your top two accounts. Facebook is your community outreach, and LinkedIn is your professional to professional networking. So LinkedIn.com, again, professional to professional networking, you need to make sure your profile is completely filled out and accurately represents who you are working for today or what business you own today. So if you have old resume information on there, it needs to be updated. You need to have an up-to-date profile picture, and you need to make sure that your title describes what you do. Not just vice president, but vice president of what? Where? So make sure you SEO your title a little bit, help your company. Join groups local to you. So if you live in New Jersey, let's say you live in West Winnemucca, Nevada. Let's change that up. Then you want to make sure you belong to the West Winnemucca Chamber group on LinkedIn and any healthcare groups on LinkedIn, and make sure you participate and read the posts and see what's going on. You've got to participate in LinkedIn. It doesn't manage itself. Just because you have a pretty profile and you accept a few connection requests doesn't mean it's going to do anything for you. It's just like anything else in this world. You have to use it in order for it to make a difference for you. You can turn online conversations into offline meetings. So when you're sitting there on a Sunday night and you're watching maybe Game of Thrones or The Walking Dead or something like that, you can sit there and reach out and make some connection requests with people that you haven't been able to get in to see lately or maybe ever, and turn those online conversations into offline meetings. LinkedIn is very important. Facebook is your community outreach. So you need to have a Facebook business page that's done correctly, and you need to maybe even create a group and join groups. And as a matter of fact, we have a group called Elder Care Entrepreneurs. You're welcome to join it, but you should probably consider creating a group off of your Facebook business page that may be hospice support, it may be bereavement support, it may be palliative care support, or just a caregiver support group in general. Whatever you want to do. People in their Facebook accounts are now seeing their friends, their family, and their groups are coming through. So you need to participate if you're going to do that. You have to keep it active. It will not stay active on its own. Facebook, your Facebook business page, you need to build those likes up to 1,000, 2,000 likes. Get as many fans as possible to your Facebook business page so that you have an audience to talk to. So Facebook is your community outreach, super important. Here are some examples of posting to Facebook on your Facebook business page. You can see at the very top, the link, the top article links back content they have written on another site, an authority site. So this client has an article that was written by them and actually was ghostwritten for them. And it appears on another website that is senior in nature, the ApprovedSeniorNetwork.com, but it also appears in their Facebook feed, which is awesome. And then they also have the next article talks about fiber, and that one links back to their own website. So that's an article or blog post from their own website. And at the bottom, home care in Cary, North Carolina activities. It was sort of a crafting idea that also links back to their website. So you want to make sure on your Facebook business page that you are blog posting on your website and that those blog posts are showing up on Facebook. This is an example of a cute meme or picture, or it's like one of those I guess inspirational messages or whatever that people post on their Facebook business page, and that's fine to do that. It's cute, but it links to nothing. It doesn't do anything for your website. So this type of outreach is okay as long as there is a mix of links back to your own website too. So articles from your website and these cute kind of things, inspirational quotes, caregiver support kind of stuff is great. It has to be a mix though. That picture by itself will do nothing for your SEO, nothing for your website. It will do nothing for you, period. It has to be a mix. Pinterest. For our clients, we set up a business Pinterest account. We make sure that all their blog posts are pinned to their business Pinterest account. It is a search engine optimized account. We encourage you to participate and pin all of your blog posts to your Pinterest account. This is not a place where you're going to get clients, but it is a great place to keep all your blog posts handy, keep all your inspirational quotes, and it's a great place to talk about your services and educate people a little bit more. Search engine optimization for hospice is different. So you have to understand what the keyword phrases are that people are typing in order to find hospice care. So they may be typing in hospice, they may be typing in end-of-life care, they may be typing in terminal illness, they may be typing in pain control. There are so many things, palliative care, that they could be typing in. So you have to know what your top keyword phrases are and then use those phrases on your website and in your blog posting so that you're search engine optimized for your not only your local area, but also for the words that these folks are typing in. So here's a recap. Number one, you want your website to be your professional image. It should be designed for lead capture. It should be optimized for your local area. It should be mobile responsive, have clear calls to action, and unique weekly content, and attract phone line if you'd like. That way you can calculate your return on investment from your website a little better. Not everybody does that, but it does help you know how many leads and referrals are coming in from your website. You want an SEO keyword plan. Now this keyword plan is more geared toward home care, but you can replace these keywords with any kind of hospice keyword phrase. You prioritize it by geography, prioritize by keyword phrase, use it to SEO your core website, and use it to guide your weekly blogging. That's what we do for our clients. Continuous content publishing. You should be blog posting a minimum of once a week. The content should be 100% unique, minimum of 400 to 500 words. It can be more. Optimized for top keyword priorities as well as many lower volume or long tail keyword phrases. You need to feed the blog post to social media and the monthly newsletter that you need to put out. You should publish local company news like stories about your people, your events, your celebrations, and you might want to publish articles with your key referral partners. So if you're a hospice company and you partner with a different home health care agency or a private duty home care agency, you might want to write articles about each other for your websites. Engage through social media. Facebook again is your community outreach. LinkedIn is your professional outreach. You want to feed content from your blog to your social media. You can boost those important posts on Facebook. You want to invite everyone on your email list to like your page. You want to use Facebook paid ads to build your likes. And you want to make sure you're publishing testimonials everywhere. You want an automated monthly e-newsletter. It should be fed from your blog to your newsletter, and it should go out automatically. You want to build the best email list in your territory. All of your prospects, your potential referral partners, your clients' adult children or family members, and you want to publish your quality information regularly. It keeps you top of mind and builds engagement and helps with communication. You want to make sure that you're publishing some articles off of your own website and on other authority sites. So for instance, Approved Senior Network has national and local sites. Our clients are allowed to publish articles monthly on those websites if they wish, and they get inbound links as well as some authority and trust building that helps folks see that they are authors in other places. We didn't talk a whole lot about reputation management, so I'm going to take a little time to do that here. There are lots of places that you can get reviews: care.com, caring.com. There is, Google My Business and Yelp, although I'm not a big fan of Yelp for hospice, home health care, or private duty because you actually check in at people's homes. They don't check in where you are, and Yelp is fraught with issues. Google My Business is as well, but we need Google My Business because Google rules the internet world. So you need to have a good Google My Business listing, and you need to pick some of your web-savvy clients and ask them to leave you a Google review. Pick the ones that are hopefully happy. You need a high volume of positive testimonials. We have a site called seniorservicereviews.com that we put together. All of our clients use it, and they use it because they are allowed to pick and choose which testimonials go live and which ones are taken care of privately between the staff and that troubled family member or whoever it might be. You want to eliminate as many negative reviews as possible. You need a third-party site for credibility, so not just on your website, but on other websites, you need those reviews. They can be distributed to Facebook and in a format that's accepted by Google, and you can also distribute those to your prospects. Your SEO person or whoever's taking care of your website should be providing some management, tracking, and reporting. So they should be providing you with a keyword plan, a tracked phone line if you want it, social media publishing reports, monthly performance reports, active SEO management, and SEO performance consultations. If they're not doing those kinds of things for you, or at least making that available to you, then you might want to ask for it or change providers because you need to know what's going on. And what about franchise owners? If you are part of a franchise, there are solutions for business owners who cannot change their websites very much. You can still do content on social media and authority sites, and you can still get reviews, and you can still do e-newsletters. So all of these things, some franchises are not able to blog post on their own website. So if you can't do that, there are tons of other things you can do, and you should do that as much as possible. We get this question a lot, so I thought I would address it here. I'm friends with a guy or gal in my local chamber group who does SEO and websites. Should I use him or her? Here are some questions I recommend that you ask. First of all, have they ever worked with a home care or hospice agency? Do they understand the needs of the adult child of the aging parent? Do they understand the needs of the hospice patient? Have they personally experienced elder care issues or end-of-life issues with a family member? Are they going to provide weekly content? Do they have access to elder care authority sites where they can post articles for you? Probably not. Do they really know what keywords are correct for home care, hospice care, or home health care? They probably don't. They can look some of it up, but it's not always correct if they don't have any insight or any relationship to what hospice and home health care really do. So what about Google AdWords? I cannot imagine that Google AdWords is great for hospice. I know that I do not recommend it for home health care or home care, private duty home care. And the reason is that we have fiddled with this over 10 years, and we have talked to experts, and we've done everything we can do to try and make paid advertising on Google work, and it just typically doesn't. You may find someone who works miracles, and that would be awesome, but I don't think I haven't found that person. So if you spend $1,000 a month on Google AdWords, every time somebody clicks on that ad, they are costing you money. So usually $800 of your $1,000 that you're spending goes to employment seekers, and $200 goes to real people in need, but oftentimes they are Medicaid recipients. Now, in hospice care, that may not matter as much if this is 100% Medicare funded, but for that other $800 that goes to job seekers, that's kind of a bummer. So you have to know what your budget limitations are. You may find that with hospice, this is a great way to spend some advertising dollars. I really, I know for home health care and for home care, it's probably not, but unless you're a big corporate office, like maybe a Visiting Angels who has a huge budget to spend on AdWords, then that might be worth it. But for most folks, it's not. Facebook ads, on the other hand, may definitely work a lot better. It eliminates that job seeker issue. We do have Facebook programs for home health care, for hospice care, and for private duty care. If you want to learn more about those, you can visit our website at ltcsocialmark.com, or you can call 888-404-1513 and talk to George. And he's my business partner. He'd be happy to explain more. This is what a program looks like. We post the content to your website. We do all of the Facebook management. We do videos. We do your e-newsletter for you. We get your audience built for you. We post appropriate curated content to your Facebook 5 days a week. We help with employment promotion if you need it. And we help with reputation management, approved senior network, tracked and recorded phone lines, and SEO keyword tracking. So all of that is available. You can source it out. I will say this, that even if you hire someone to help you with some of this stuff or all of this stuff, it really is important that someone in your organization participates and engages with all of your social media. It's super important. If you have any questions, you're welcome to go to our website at ltcsocialmark.com. You can call us at 888-404-1513. You can email George, my business partner, at george@ltcep.com. He will help you with instant pricing and information and a smart conversation about your real needs versus your budget versus doing nothing at all. And I thank you very much for sitting through this presentation and watching or listening. If you have any questions, again, just give us a call at 888-404-1513 or go to our website at ltcsocialmark.com, and we would be happy to help. We talk to and help hospice agencies all the time. So I appreciate your time. Thank you very much, and we'll talk to you soon.